Welcome to Exposed Vegan Media Podcast, Season 2. I have so many new amazing guests, and I can't wait to introduce you to my first guest. Her name is Dr. Shayla Toombs-Whithers. Hi, Shayla.
Hi, I'm excited to be here.
I'm so excited that you're here. I'm so excited to see you. I feel like my last time remembering you is when I was dying on Ironman Chattanooga and you came out to get me. I swear I will never forget that moment. I was like, oh, I want to go home.
You were doing great. I think we have all been there in a race for sure. Or it's like, I need to make better life choices.
And then I saw you. It was like a bridge. Like, just jump. and then there you were. I was like, oh, Jesus sent someone for me. So I feel like I haven't seen you since. I mean, I know I've talked to you since then, but that's always in my memory. So yeah, it's so great to see you. And for those that don't know you, why don't we just go into it? Why don't you share what kind of doctor are you?
Yeah. So I am board certified. I'm a physician, board certified in family medicine and obesity medicine. But then I also hold a certification in plant-based nutrition, certified as a menopause specialist. And then more recently, I've also been doing some functional medicine training. So I practice with a more holistic, integrative type of model.
See, and that's why I follow you, and that's why I read all of your emails. Because even though
somebody's reading them, you never know.
If no one else, there's me. I'm highlighting. I'm like, oh, is that why? So that now that you've shared that, your certifications, it totally makes sense why your emails are so thorough and why you share all of that information. I'm totally reading and following. So thank you for doing that, and thank you for continuing to do that. If you could share, what is the name of your practice and what is the why behind that and why you've started everything?
Yeah, and I love that question. So my practice name is Essence of Health Wellness Clinic and Coaching. And so I have a brick and mortar wellness clinic here in Chattanooga, Tennessee, but then I also offer virtual care to several states as well. But the why behind my practice is really because I felt like I could provide better care to patients and the care that I felt like they deserved. I've been practicing now for about 15 years. Time flies by. And so, and I've practiced in a number of settings. And so what I found was that either, when you're in these traditional settings, it's always like rush, go. How many patients can you move through the clinic, or, how fast can you see them? And I felt like I was just providing what I call Band-Aid care, where it's like, all right, we're just going, slap this prescription on it, see you back in a month or so, and we'll slap something else on it, instead of really getting to the root issue and being able to educate my patients and give them just something deeper and something more so that they can actually heal and not just keep, slapping those Band-Aids on things. And so I opened my practice a few years ago, just really so that I can do that. So it's a membership-based model. So I spend minimum of 30 minutes. Most of my appointments are 60 minutes. And if we go over a little bit, that's fine too, because I don't double or triple book people. All of my patients are considered members. And so they have that direct care. They can send me text messages, emails. I share articles and things with them, podcasts, even this, recipes, especially like from your book and things like that. And so, I actually, even though I still prescribe medicines, but I also prescribe health. So I'll also prescribe, eat more beets. I'll also prescribe, get more sleep, or, go for a bike ride. So it's so much more than just that traditional medicine.
Yeah, and I love that. And I think that's why I continue again to read all of your newsletter, your posts. And I'm excited because I've joined a group that you've started. So I'm really excited to share there and to continue to learn from you. And just another thing, I remember when the pandemic first hit, and I was very confused about everything that I saw on the news.
Yeah.
And then when you were holding these live sessions and you were sharing everything that you were doing in your practice and with your family, and your husband is very funny. He was sharing what he was doing to support you in your practice. You had like a webinar, and I had my kids sit down and watch with me.
Mm-hmm.
And it was the first time that we saw a person of color actually share what was happening because honestly, I just didn't feel comfortable trusting the media. And then when you shared everything that you were doing, I realized it was way more serious than I anticipated. It wasn't something that I could just ignore.
Mhm.
And two, that I needed to do something about it. So I need to do my part. Obviously, I wasn't going to be a doctor overnight, but and do what you were doing. But I knew that I like to cook.
Mhm.
And I love to cut vegetables, and there were so many things that I love to do and to feed people. And you were one of the inspirations behind Exposed Vegan because there were parts of things that you were sharing, which I was like, I cannot relate to that and help with that. But I can relate to what's the best way to cook beets? Like, what's the best beet juice that you can make? What are some recipes? And so I was really inspired by you through all of that. So I just want to thank you for that because everything that you were sharing was so important, but I was able to relate to it and understand.
Great. And thank you, for sharing that because one of the things, one of the slogans that I use for my practice is the essence of health is in you. And the reason I say that is because each one of us, we do have our bodies are magnificent. Our bodies can heal. Our bodies are able to fight off infection and disease processes and can actually heal if we do those, certain things and put good things into our body and treat our bodies well. And that health, it's within each and every one of us. And so, when you say that, you are a perfect example, of that point of you just kind of took charge for yourself and said, I'm going to start doing these things. I'm going to eat more clean. I'm going to eat more healthfully, and just healing your body. So that essence of health, it really is. It's in each one of us.
And more than I learned from you, I remember going to see my doctor after I was having a lot of pain in my knee. Like I didn't know what it was. For some that don't know, I broke both of my legs when I was 17. I fell off a bike, so I have a pin in my knee and a pole in my leg. Totally fine because I'm clearly still doing things, but I was
All the things you are.
I'm still moving around. And but I was like, let me just see if something shifted from when I had the surgery when I was 17 years old. I'm almost 50, so it was just like, well, maybe something's moved, maybe something's happened. And it was determined that I had arthritis, and he gave me the physical therapist, very thorough. He gave me, some options. He said, I was too young to have knee surgery, so didn't think I should do that right now, but it was something that he thought maybe in the future. I could get injections on a regular basis. He could give me, pills, medication,
Right.
or I could keep my weight down, do exercise, and change my diet. So I was just like, why don't you start?
Right. Let's start there and then we'll see if we do all the rest of it. So yeah.
So that's another reason why I became vegan because I was just like, I do not want to live with this pain. I realized the pain in my knee is coming because of the weight that I was gaining. My weight would fluctuate. Maybe if I changed my diet, that would help. And I was like, I feel so much better.
Yeah.
I don't need injections or knee surgery.
Right. Yeah. Because what a lot of people don't realize is that we can eat foods that are natural anti-inflammatories. And then there are other foods that will naturally cause more inflammation, So if we're putting in a lot of those, then you are going to be more prone to pain and all these other issues versus if you're putting in those helpful things that actually fight those processes in your body and actually reduce that inflammation, you'll start to feel much better. And then, even if you needed medicine, chances are you'll likely need much less of it, So instead of you needing a pill every day, maybe just once a week or once a month, when it's getting really bad, which is much better, overall for your health.
Yeah.
Yeah.
And I think, whenever I read your material, it really reinforces the decision that I made, as well as the ownership that I can take for myself on the things that I can do to make my health better. So your slogans, I definitely, it resonates with me. So again, keep doing what you're doing.
Thank you.
And I'm reading, and if anything, you're helping me.
Good. Right. Well, at least it's somebody. And I appreciate that because, a lot of times you're a small business owner as well. And, a lot of you're sending out these emails like to the universe and like, who knows who's going to see this?
I'm talking to myself. So yeah, it's always helpful for people to reinforce. But the other thing I want people to know about you is that you are an Ironman triathlete. For those that are not aware, because I do have new listeners that don't know what an Ironman does or what they do for a competition, it is a triathlon. And the person has to swim in a lake, river, or ocean for 2.4 miles. They have to they have to bike for 112. In this course, you were 112, right?
Yeah.
And then you're running for 26 miles. And so she also has married and has 3 kids and managed to compete in an Ironman and complete it. And I was so impressed. So
I know. And when you said, I still think about it, and I'm like, did I do that? I was there.
And I know I saw you cross the finish line. And the thing is, she has 3 kids, but she has little kids. I mean, they were little at the time.
Yeah, they were little. Yeah.
And she still managed to get it done. So for those that are triathletes and that were managing, can you share a little bit about your strategy? Like when you were managing that, the workouts, the kids, and even your nutrition?
Right. Yeah. And I'll say even the nutrition piece first, I really dedicate that, to the plants and the plant-based diet that I was consuming because, you as a fellow triathlete, when we're training for that level of race, it's like a part-time job. You're training easily a minimum of 2 hours a day, and so there are times where you could just really feel beat down and pretty sore. But I would always make sure I had beet juice, a beet juice smoothie after, especially those really long cycling or running workouts, just so that I could reduce that inflammation within my own body. And I would always make sure I was eating plenty of dark leafy greens as well, that other anti-inflammatory type food. But then even the balancing piece of it, with the kids and everything, a lot of times I would do really early morning workouts before, they had to go to school or get up and do their thing. Or I would even work out over lunch. A lot of times my lunch break would be to go to the pool and swim for an hour instead of, eating lunch and have like a protein shake or something on the way back to the office. So there was definitely a lot of that going on, during the week while training for sure. But really, from the nutrition piece, I just owe so much from that because even those times I recall, doing those long rides over the weekend where you're really trying to learn, what kind of foods are going to sit well on your stomach because it's hot, you're sweating, you're out there for all of those hours, just exerting yourself, and just even figuring out those pieces. And so what I, started to do, I found for myself, is that those really unprocessed, high fiber foods tended to work better for me from a protein and from a slow burn perspective. So I would typically do like oatmeal, bananas, with some nuts, typically before like long rides, in the morning. And then that way it would sustain me for a good length of time. But then my magic fuel, and I always tell people this, and the reason you'll see why I share it in a minute. So my magic fuel, even after like midways through those long rides that were like, 70 or more miles, halfway, I would have to have me a Coca-Cola, all full sugar Coca-Cola. And when I tell you it worked like jet fuel, and the reason why is because I don't drink soda any other time.
Wow.
So for me, when my body would get that sugar caffeine, my body was like, whoa, what is this? And that is the only time that I would drink it is for like a long, like right in the middle. And even race day, my special needs bag was a cold, ice cold, regular old canned Coca-Cola that I like, stuffed down in my shirt and sipped from the halfway mark of special needs. And it was like jet fuel. And I say that to say because, when we're eating more clean and healthfully, then our bodies do have that more sustained fuel. So then when my body got that, processed sugar and caffeine, and it's like, okay, we can rev her up a little bit. We aren't used to having that. So, but it wasn't anything that I did all the time. But yeah, I just found that was, just that little thing was just so funny how my body responded to that.
It's so funny. I can relate to that. I think I haven't had a Coke in a long time, but I feel like there was one race where I didn't want the chicken broth. I didn't want it. It might have been Texas. But then I think I finally did have a Coke and it was like, what is going on? She doesn't do this.
And I think that's actually how I discovered it. Cause like one of the shorter races, you go by the little station and I think I had a little, and I was like, there's something to this. And so I started just doing it at that halfway of the bike, and I was like, okay, yeah.
Yeah, sometimes I do put my body into a little bit of shock, but then I'm
Right.
like, don't
Mhm.
expect this. We're not doing this again the next
Exactly. But I think that's the only reason is why it works is because you don't do that all the time.
So there's a couple of tips that you've shared since, like I said, I am an avid reader. So I wanted to see if we can get into some of your newsletter tips,
Yeah.
just so we can encourage others why they should really subscribe. So I remember, I think at the end of the year, you were sharing some tips around goals.
Mhm.
And making smart goals. Like, can you share like why that's important and what
Yeah.
people should do to start off the year around their goals?
Yeah, yeah. And so I typically share those smart goals tips because I'm one of those folks that try to steer people away from just saying, oh, my New Year's resolution, I'm going to, lose 50 pounds or whatever. Because we know New Year's resolutions, they've done studies on it, and they've shown that for most people, within the first 2 weeks of January, that resolution has already gone out of the door. And by the end of the month, you're just well off track. And then what happens, we get frustrated with ourselves, and then we're like, okay, well, that didn't work, so I'm just done with it. So when we make though goals that we've actually sat and thought through and use a bit of strategy to making those goals, then it has been shown that we'll be more successful with them. So I typically use really the SMART method for that for people. And so you want to be specific, first of all, with that goal. And so a lot of times, let's say for instance, if your goal is to do a triathlon, you're going to do a sprint try this year. So, specific, you're going to say, I'm going to do this sprint try. And so you look at that date, you have that specific goal, and then measurable. So you know that you're going to need to do, maybe this much on these days, or maybe, by this point you would have need to work your way up to cycling this many miles or being able to swim that many yards. So you have something measurable. So each week you'll know, I went and swam 50 yards today. So then maybe by next week I can swim at 150, and then you're working your way up. And then, you're assessing that, and then you're sticking to that much more easily. And it's timely because you've set that time limit that, this race is on this day. So you have really that to kind of laser focus yourself in. And chances are you're going to be much more successful than if you just said, oh, I'm gonna, maybe by, March, I'm going to be running 3 miles, but you haven't set any race. You haven't set any kind of strategy. You haven't, done any of those things. Just like, oh, somehow I'm just going to do it, then by the end of January, you're probably like, oh yeah, that mile, that was enough. So just really, taking your goals and even just breaking them down into smaller steps, and then, just putting those time frames into place. And then even other aspects of that are community. You and I, we even first met through, our Facebook group community. And that's so important because, we always talk about like drinking the Kool-Aid, but you'll meet other people who are doing things who will inspire you. There's been so many people in these groups who have inspired me, to go out and do these things. And so community also helps a lot when we're trying to goal set and succeed in those goals.
Something else that you shared, which I was so helpful for me and I resonated with, was just you had a theme of healthy hustle and thriving on the go. And I feel like I'm always on the go. Like I'm always, doing things on purpose. I get it honest. I get it from my mama. But you also shared like some healthy tips and healthy snacks you can think about when you're on the go. Can you elaborate a little bit on that? Because I remember.
Yeah, yeah. And honestly, I think you do a great job at this because I've actually followed your posts and see when you do like your prep boxes and things and your little lunch bag. And yeah, you do a great job with that. But yeah, for those of us who are on the go, that is important. So you want to make sure that you have good storage things that you can carry things with you. So even if it is the little plates that you can do your meal prep in, and that also allows you to think of ahead instead of thinking when you're hungry or when you're hangry, you know, and you just willing to grab anything. But that allows you to think ahead. So you're thinking already healthfully, what's going to fuel my body through my day or through my week. And you are able to decide those things. So, you know, one tip I would definitely say is plan ahead, so that you can think through that healthfully. And then the other thing, you know, I would say is use hacks and things that help you to make things easier. For me, I have an Instapot. I love my Instapot because I can, you know, set it in there and go take my shower, go do whatever I need to do for the kids, come back to it, food is ready. You know, a crock pot, you can put it in there before you go to work. By the time you get home, you got a meal. So use those things as well, because that's going to make, you know, your lifestyle that much easier, without you having to feel like, you know, you've worked all day and now you got to come in the house and, oh, now I got to cook, and you know what, am I going to cook? Well, you've already planned ahead and done that thing. And then those healthful snacks, so some good things that'll actually fuel you. Popcorn makes a great snack. It's whole grain, you know, so that's a good snack for you. Chickpeas is another one that I like. Roasted chickpeas, those are good, high in protein, high in fiber. Kale chips is another one, especially if you know, are craving like that crunch. Kale chips is a good on the go, easy on the go snack. And then for a packaged one, because you know sometimes we do have to grab something out of a package. I actually like Lara bars. I don't know if you're a Lara bar fan or not, but I actually like them. And the reason I like them, because they are typically a good protein source, a good fiber source. They're typically sweetened naturally with dates. And then they'll usually have like a little bit of nuts, depending on which type you get, or some fruit in them, but no other kind of additives or things. So it's really a good clean snack, especially if you're one of those people that may need a little pick me up kind of midday, because you know the dates will give you a little bit of sweet, but a good source of that. And so those make for a good snack too.
I actually started to make my own bars. Um, Looking at those different recipes between the Lar bars and I call them protein squares, so that'll probably be something that I share in my next book. I just sometimes I just don't have the time to stop. And to your point, like if I don't plan, I'm pulling over for french fries. Like I just it's just the worst thing for me. So I have to have like a baggie of nuts or something. Like I'm going to the gym tonight and I already have like a snack bag. So when I get in the car, like the gym isn't around the corner. I'm going to be driving for 20 minutes. Like I need something to eat like while I'm waiting for the cherries or something to have on the go. So when you shared that, I was like, "Oh, okay, I do that. Check."
Yeah, yeah. And I'll tell you another thing I do each week. I'll start each week, I'll buy one of those big tubs of spring mix salad and a big tub of spinach. Because I know, you know, through the week I'm gonna use them for several things. And that also makes it a little bit easier, because sometimes during the week, you know, you just gotta keep it really simple. So, you know, I'll put the salad and I'll throw, you know, maybe some tofu or some beans or something over it, and some dressing, and a little bit of rice or something all over it, and you're done. You know, but having those things on hand to make it easier.
And the thing I do with that, like the spring mix and the salad, I do the same, but I do that for my like 2, 3 o'clock meal because I'm in corporate America. And by like 2, 3 o'clock, because I worked out so early, I am just ready to be like done. And I don't want to get in my car on the way home and again stop for French fries. So I try to like eat like a spring mix salad that has the same thing like chickpeas, maybe some craisins on there, so that I won't feel like, oh my God, I can't wait till I get home to get the food. I had something right before I left the office. So for those on the go, we gave you a couple of tips, some things to use so that you can do like us and stay away from the french fries.
Right, right, right. And then if you've had that salad, chances are you'll eat less of the French fries. So how about that?
Right. Because I just know we're sitting in traffic. God, I just always thinking about food. So yeah, that really resonated with me. You also shared some interesting statistics about cardiovascular disease being one of the number one causes of death. And with February being Heart Health Awareness Month, are there some preventative things that you can share around that?
Yeah, for sure. And I'm happy that you are highlighting this because, yeah, cardiovascular disease is still the number one killer of Americans. For women, it's still so important that women that we protect our hearts because a lot of times our symptoms don't even look the same as others. And then for people of color, we tend to be affected from these conditions far more than our counterparts. And so it's really important for our communities to be aware of these things. And so there are some things that we can do. One, we want to keep our blood pressure and our blood sugar under control because both of those can be cardiovascular risk factors that can put us more at risk for those heart attacks and strokes. Ways to do that: diet, like we've talked so much about, exercise too. And you don't have to go out and be a triathlete, folks. You don't have to. But even if you're doing just 30 minutes a day, that's good. You're getting your heart pumping, you're getting your blood moving, you're helping to lower your blood sugar, lower your blood pressure just by doing that. So do that. And then the other piece, you want to manage your stress, because we do know that stress kills. Stress raises cortisol, stress raises blood pressure, stress can lead us into heart failure, strokes, heart attacks. So we definitely want to manage our stress. In managing your stress, though, a lot of times these things actually intertwine with each other, because one way to manage stress is to exercise. So you can be managing your stress and going for a run at the same time. Another way of managing that stress is getting good rest and sleep. We do know when we get improper sleep, then that actually sets our hormonal balance out of whack. And then that in turn raises cortisol levels, causes food cravings for unhealthful foods, then which in turn can further raise our blood pressure, puts us more at risk for those cardiovascular health problems. Other piece, don't smoke. No amount of nicotine has been shown to be safe. It just isn't. Sorry, folks. And then, right, and then alcohol. We do have to regulate the amount of alcohol that we consume as well, because alcohol can raise blood pressure and in turn put us more at risk for heart disease. So, really a lot of these things, as people, we tend to know, but a lot of times we don't conceptualize it to a point of when we make certain decisions, how is that going to impact our heart health or impact our bodies, negatively or positively, depending on the decision that we're making. But, if you had to start somewhere, make sure you're getting good sleep, 7 to 9 hours per night. Put in some plants on your plate, especially dark leafy greens and beets on your plate. And then, moving your body. So if you had to, start anywhere, start with those three things, and you'll go a long way with protecting your heart and lowering your risk for cardiovascular disease.
Thank you for sharing that. So, one thing that I wanted to bring up, so it's cold and athletes are, kind of they're getting ready, they're moving their bodies maybe a little or even a little less than they were during the warmer seasons. So, what do you recommend, especially you being an athlete yourself? What do you recommend that we at least make sure we're getting things done in the winter season, like while it's really cold?
Yeah. So, depending on where you live, some places where it's just going to be unsafe to even be outdoors for an outdoor workout. And so, if you live in one of those places, then definitely, take it inside. And whether that be you set up your bike on a trainer so that you can cycle indoors, or even if you just have a stationary bike, do that, as well. Get on a treadmill. That's a great way of doing it. Indoor pools. And even for folks, I understand that not everybody's going to be a triathlete. So even for people who don't swim, oftentimes I'll still recommend that folks even walk laps in a pool, just because water is a good way to get a workout in while also reducing inflammation within the body, because it takes a lot of pressure off of the joints. So, those are definitely things, that people can do in the winter time. And then if you are able to, if you live in a place where it may not be quite as cold, so you can still get outdoors, still go outside. We talked about managing stress. We know that outdoor and sunlight and fresh air is a natural way of reducing stress. So if you can still get outside for a workout, even if it's, 20 or 30 minutes that you can be out there safely, then go do that, because you'll get your workout in, but you'll also help relieve some of that stress, especially, if you're hardworking folks, who are on the go a lot and you need that moment anyway. Be sure to layer up. For women, they make tights, and some of them are fleece lined. I've used those in the wintertime, some of the fleece lined tights, to help so that you don't get too cold while you're outside. Always, protecting your head, covering your ears as well, is helpful. You can use the little hand warmers to keep your hands warm, as well as, they make the gloves, neoprene style gloves too, so that you don't get too much water. You definitely want to make sure you're still using your moisture wicking type of clothing, because especially in the cold, because you don't want all of that sweat sitting there on your body cooling you off too much, because you will be sweating still up under there. So layers are definitely key with that. And then otherwise, just keeping it safe, making sure you still are wearing those materials where you can be seen more, because usually this time of year, a lot of times it gets dark earlier, or it's more foggy and then we've had snow, so the visibility is low. I saw a cyclist just the other day, and this was a guy, and I saw him, and he had on a hot pink, like the brightest hot pink cycling coat you could ever see. I was like, okay, he is doing the thing right. He's like, y'all gonna see me on this bike.
Okay, so for the people who want to connect with you virtually,
yeah.
I believe you offer like some classes or workshops. Like, can you share what you provide for a virtual client?
Yeah, sure. So there are two virtual options where folks can work with me. I do offer virtual healthcare into my lifestyle medicine membership program, where I am able to help you manage, prevent, reverse your chronic health conditions. And so that's offered in the states of Tennessee, Georgia, Alabama, Virginia, Alaska, Missouri, and Massachusetts. So those states. Where I'm able to see you and be your concierge specialist. We're able to sit down. I'm able to give you a plant-based nutrition plan. I'm able to manage your medications as well in those states to help you really with your overall health holistically. And then for folks who don't live in those states or live anywhere else and just would like coaching with me, I have the Mind Body Balance Collective is what it is. It's my virtual group coaching. I go live for the group twice a month within that. And then we have a separate app where folks day to day can tap into resources. They can ask questions, post recipes. I do give brand new recipes to them each week. And then, we really dive into those pieces that I mentioned about how those things within our nutrition and within our mental health and within our physical health are all intertwined. And so we really tap into being able to create that balance for folks to be able to just improve their overall health and wellness.
So in other words, there is no excuses for anyone. There's several ways that they can connect with you. For those who live in the same state as you, they can connect with you. And then there's areas where you practice and you can provide virtual coaching. And then there's the other coaching outside of those states. So I am so grateful that I started season 2 with you to help everyone get on the right step.
Right.
Forward. Can you share just a little bit more of how listeners can contact you after this session?
Yeah. So I'm also a podcaster. And so for folks listening, you definitely have to check out my episode with Jaja. It's the Essence of Health Tea Time podcast. And so I'm on Apple, Spotify, all of the podcast apps where you can catch a little bit where I spill the tea of all things health and wellness and plant-based nutrition with the podcast. And then my website, I can be reached at drshayla.com /EOH. That's drshayla.com /EOH. I do offer a free 5-day mini course. It's called Nourish and Flourish, where folks can sign up, especially if you're new to plant-based. I definitely would recommend it because I share some easy to do plant-based recipes within the Nourish and Flourish program. And each day you get some tips from me through that 5-day program, and it's totally free to sign up for it. So.
Thank you. And like I mentioned, Shayla is someone that I have been following for several years, and she's made things for me and my family so much better. So I highly recommend that you reach out to her or you look up her information. There's always going to be something that you're going to learn. Shayla, is there anything that you would like to leave us with and close us out with?
Really, that I'm take it back to that slogan, the essence of health is in you, in each one of us. So just be kind to your body, put those good things in, and you'll reap good things out.
Thank you. It was
Yeah,
good to see you. Great
yeah, you too, of course.
to
Yes.
catch up, and thanks so much.
Are you looking for more healthy recipes? Check out my memoir, Running for My Life. It's packed with recipes that have fueled my journey and can inspire yours too. Grab a copy today at exposedvegan.com. And if you enjoyed this podcast, don't forget to hit the like button, comment, and subscribe for updates, tips, and much more. Thank you for watching, and I'll see you next time.